I think those people who successfully engage with the programme can do really well. So, it helps with the non-medical aspects that I can't necessarily do much about as a GP. So if we think about people's ability to exercise, their diet, it can help with weight loss, reduce social isolation, it can help with debt, welfare advice, connect them into community groups, help with some volunteering. So there's lots of positive benefits that I've seen from patients of my own who've gone through the programme.
I've been here for nearly a year now working as a GP, and in that time I think I've increasingly started to work out what a valuable kind of resource it can be. Started referring more and more patients there, and often getting really good feedback back from the kind of whole host of options and resources that are available to patients. So I suppose my involvement really is at the referral stage, and also at the feedback stage from patients who we see months down the line, and often with good news to report.
What I feel is that the ones that have engaged with it have found that it's been really helpful, and it's just given them that little nudge. I find that they seem to say that it's much more personable, so it's not like I'm referring you to an online form and you've got to look up this stuff, but there's actually someone that gives them a call, sits them down and kind of bespokes and tailor makes something for them, which I think makes a really big difference to some people, because they want that conversation with a real person really, and that encourages them to kind of take on and make those kind of changes in their lives that they need to.
Both from patients and for doctors, I think it really helps to show that there's all these resources are out there, and often it's easy to think that we work in isolation. Just the patient comes to the GP, they go home, and that's that. But primary care is so much more than that, and I think the social prescribers and Wellbeing Matters just highlight all of these great resources that are out there. So I think it's been really kind of eye-opening, both for patients and for doctors, to kind of see what really is out there and what's available.
I've always been a big fan of social prescribing, but when I started off in my career, it was more kind of little local groups that were offering bits and pieces, and then sometimes I'd refer and they'd run out of funding and they couldn't do things, and it was a bit of potluck. Whereas what Wellbeing Matters offer is just so professional. It's connected up on our computer systems, so the referrals are really easy to make, and we can give them the information that they require to kind of get the best out of a referral. And then it just general practice has changed in that I think in the past, in the deep dark past, it used to be a very medicalised model. People would come in with a condition, we'd offer them medicine or surgery, and that was like, where does it fit in that? Whereas we're much better at realising that people are people, and that conditions can exist, but if all the surroundings are different, there's a whole different case that's going on, and we need to have the tools to be able to deal with these cases. And so just giving medication, antidepressants, weight loss medication isn't the kind of final answer, but actually looking at the wider picture of the person, realising how it fits in with their life in terms of how things are with loneliness, with their social isolation, with activity, all those things, with language even, finding a group where they can find people in a community that can speak the same language and stuff. That makes a massive difference to people, and we realise that this has a bigger impact on people than just giving them antidepressants or sending them to counselling all the time. So the offer is far greater, but we're not experts in what's out there, and that's why Wellbeing Matters is fantastic, because they are the experts, and they have their finger on the pulse. They know what's active then and there in the community, and so they can deal with that. And also it's very personalised and bespoke for these patients, so they also get that that tailor-made package to help them in that wider scheme of things in a holistic way.
Yeah, I think for those people who are living with long-term conditions such as respiratory or diabetes or mental health, then things like exercise, you can lose your confidence to exercise, so having somebody to support you with that, improving your diet, your sense of well-being, all of these factors are really important in helping people to be able to manage their conditions more effectively, and are perhaps the bit that the NHS doesn't do as well.
It's so important that there's someone who is kind of conducting, if you like, the all these services, and have the finger of the pulse of what's where, and I think it can be quite hard as a GP to know what those resources are. It's constantly changing. So I think the social prescribers just bridge that gap in such an important way.
There's a big focus on neighbourhood working in the 10-year long-term plan. I think social prescribers now are very much an essential part of the primary care team, so we view them as being integral to what we offer. We know our wellbeing connectors as well, so we can reach out to them. So an essential development and a very welcome one as well, because it actually reduces some of the demands on GP practices, because people have got somewhere else to go to get the support that they need, rather than perhaps always coming to the GP or accessing statutory services.
Feels like we have more in our arsenal as GPs that we can give for our patients, and that's only a good thing.